Alagille syndrome is a rare genetic condition which affects multiple parts of the body. The gene that has the defect in it is usually something called JAG1, and in some patients there's another gene involved called Notch. These genes are very important in regulating development of the body very early in life, and therefore lots of different systems and parts of the body are affected. The JAG and Notch gene mutations that cause Alagille syndrome are inherited usually from a parent, one or other parent, in about half the children with Alagille syndrome. In the other half, the mutation occurs spontaneously in the child. In the children where the parent, one or other parent, is affected, because Alagille is so variable, the parent may be so mildly affected that they may not even know they have the disease. They may have no symptoms or signs or any abnormal blood tests. And it's only when the child develops symptoms that we know that the parent, by testing them, has Alagille syndrome. Alagille syndrome predominantly affects the liver, but also the heart, the blood vessels in the brain, the kidneys, and the eyes. The symptoms of Alagille depend on which part of the body is predominantly affected, and often more than one part of the body is affected. So if you have liver disease, you can present as a baby with jaundice early in life. That's yellow colouring of the eyes and the skin. And you can develop progressive liver disease with failing to gain weight, diarrhea, and very, very severe itch. You can also develop xanthoma, which are little lumps of cholesterol under the skin. Another major system that's affected is the heart, and often there is narrowing or abnormality of the blood vessels in the heart and the lungs, and this can present with the baby looking blue at birth and needing some urgent treatment. The other features of Alagille are a little bit more subtle and need tests to find them. So, for instance, the changes in the bones and the changes in the blood vessels in the brain require special scans in order to be able to detect them. The treatment for Alagille syndrome depends on, again, which system is affected. So if it's the liver disease, we initially provide special formulas and supplemental vitamins so that the child can grow properly. If there is a very severe itch, we have a range of medications. In fact, this is one of the areas of medicine that's advanced quite a lot. We've got some very interesting new medications which will shortly be licensed for use that treat the very, very severe itch in Alagille syndrome. If the liver disease progresses, then perhaps a liver transplantation may be required, but it's not required in everyone. The heart disease needs treatment based on how severe it is, and often children will see a cardiologist and have special scans done to determine whether they need any surgery or just monitoring. Life with Alagille syndrome, again, is very variable because it is such a variable condition. Some people are very, very mildly affected and don't even know they've got Alagille syndrome until they're adults and may have some abnormal kidney tests or have an X-ray which shows some abnormality in the vertebrae. Other babies present very, very early and extremely sick and have a liver transplantation within a year of life because they are very sick. So the life with Alagille syndrome is very variable according to how badly you are affected. We have had children who have been very severely ill at birth, who have grown up, required liver transplantation, got married and had children. So there is a good outlook as well. I think it's important that the diagnosis is made early. So if there are any suspicious symptoms or if your doctor feels there are features of Alagille syndrome, it's important to get referred early to a specialist hospital, in fact, and with a paediatric gastroenterologist who can look after the many aspects of Alagille syndrome together with other specialists in heart and eyes and kidneys, etc. It's important to maintain a healthy diet and, of course, a positive outlook on life. We don't really understand why two people with the same gene mutation can be so different. For instance, in the case of the parent who is completely well with no symptoms and the child who has the same mutation who has very severe liver disease from birth. There are a lot of scientists working on that question because it is a very tricky one. Having Alagille syndrome can be very confusing and very complex, so if you need to reach out for additional help, there is plenty of help available. I would suggest the Liver Foundation website that has lots of information, and also where to get other information from. In addition, I would definitely suggest that you reach out to your doctor because they will understand most about what types of Alagille symptoms affect you the most, and therefore what you need to be looking out for. And then finally, I'd like to mention the GALA study, G-A-L-A. That's the Global Alagille Alliance, of which we are a part. That is a multi-centre international study looking at Alagille's patients from all around the world. Because it's a rare disease, we learn a lot more when we pool all of the information together. And this GALA consortium has published a lot of papers which are available on the internet for families to read.